story.
Is it okay?
Yes, it's working.
That's great.
Okay,
Let's
announce
start.
it.
Please announce it and let us start. Hello
Okay.
everybody. Some of our followers are coming for our live presentation.
Guys, we're starting the live session. She's going to answer all your questions. Come on, come in.
And you
Are
will
they
say me the questions.
Of course.
I hope. It's impossible for me to see both of them.
Yeah. Okay. So the people who are here right now الموجودين هون يكتبوا أسئلتهم. إذا كتبتوها بالعربي رح إلها بالإنجليزي. And if you write in English, we both can understand, and it will be great. Thank you so much. Oh, this is Ismail. Just
Wow, Ismail, hello.
Hello, Ismail.
It's great pleasure for me to see you here.
إذا عندكم أي أسئلة اكتبوها مشان نسأل الدكتورة ونبلش. يلا.
And maybe while we are waiting, let me tell about my story a little bit.
Okay.
I started to manage the hair problems with my patients till 2012. It was a great experience for me because when I started to have tourism, I realized that there are many patients coming to Istanbul for hair transplantation. But hair transplantation is not only the solution. So first you need to understand the problem, if it is genetic, if it is hormonal imbalance, if it is vitamin or mineral deficiency. So in my office, medical office, I started to examine my patients, and I realized that many patients coming from different countries has got different problems, like hormonal imbalance, like vitamin mineral deficiency, like allergy problems. So I realized that first, as a medical doctor, you should solve the problem about these patients, and then you should plan the hair transplantation operation. So when you do it in this logic, you have got great success about it. Nowadays, in our clinic, we do in this way. First, we made hair checkup. I made the examination, I sent the blood and urine to the test, and then I got the results, and I apply 3 ways combinations, 3 different directions to manage the hair loss problem. One is the oral replacement treatment, and the second one is local replacement treatment, and the last one can be mesotherapy, PRP, or hair transplantation. And when you decided to make hair transplantation, it is important as a medical doctor to give the decision which methodology you will use. Will I choose direct hair implantation, or will I choose sapphire knife follicular unit extraction? This is really needs expertise. That's what I would like to highlight. Okay.
Okay, write your questions. Please اكتبوا الأسئلة تبعتكم حتى نقراها ونجاوبها مع بعض. Okay. إذا ما عندكم أي أسئلة كتير رح نزال يعني عاملين هذا اللايف بس لإلكم. We did this live just for you, so you can ask all the questions you would like to learn about hair health and the treatments available. شو الأسئلة اللي عندكم حتى نجاوبها؟ We are waiting. Be curious.
Yes, I'm waiting for your questions.
Yeah.
And maybe just for the followers, let me continue to give some useful information. First of all, it is really important for us when your hair loss started. It is really important because if it is started just 6 months ago or 1 year ago or many years ago, the diagnosis totally change. If there is something that induced your hair loss, and if you saw, if as a medical doctor, if you understand that problem, then you can manage the situation that started the hair loss, and you can solve it. And on the other hand, if your father, if your grandfathers, or if your mother has got, as a woman, or your grandmother's mother or grandmothers, your aunts has got hair loss, then it is probably genetic, and the first solution can be a hair transplantation. So the story is really important. Please be careful when you go to a center for hair problem. Please observe that if the medical doctor is asking for your story. Story tells us many things. Please be aware of this. The only solution is not the hair transplantation. Hair transplantation is a certain solution, but let's combine it with the other problems that are present in your life. If you change the country, and if you come to a new country, all your lifestyle is changing. And regarding this lifestyle change, you should manage the foods that you take inside, because food is medicine. I always underline this problem. Whatever you eat, it is yours. So please be careful about it.
Yes, perfect. So we're not seeing any questions. ما عم نشوف أي أسئلة لسه. يعني we're still waiting for questions, but you're not answering anything.
There are lots of hearts. Thank you for your hearts, but please send us some questions, because I don't want to give standard answers or standard information directly regarding your problem. I would like to answer the questions.
بدنا نجاوب أسئلتكم، هذا اللي عم تحكيه، فنحن فاتحين هون حتى نجاوب الأسئلة.
And what else I would like to highlight here? My first step of hair transplantation is hair checkup. Please do the hair checkup. And now I would like to share with you. I got a patient coming from USA, and 6 months before, for example, here, I need to close the name of the patient, so sorry for that. But if you can see it, here we are looking for, I'm sorry, let's do it like that, the name should be closed. But I'm looking for calcium, magnesium, zinc, iron binding capacity, the hormonal values, and thyroid hormone is really very important about this issue. The iron level is really important. If the patient has got iron deficiency, you cannot solve the problem with hair transplantation. For example, for this patient, she has got iron deficiency, she has got vitamin D deficiency, and she has got biotin deficiency. We did the first hair checkup in January, and then we started oil and local treatment, and we started hair replacement treatment. She was here for hair transplantation.
Just a second.
Okay.
نحن هون عم نستنى أسئلتكم، فلوقت ما تسألوا عم تعطي معلومات عامة، فلهيك نحن ناطرين تسألونا شيء لحتى نحكي بشيء محدد، بس انتم ما دام ما عم تسألوا هي عم تعطيكم معلومات عامة.
And now, after 6 months of treatment, oral treatment, the patient doesn't have anymore the iron deficiency, vitamin D deficiency, so they are better now. But in this new test, we realize that the metabolism is low. So we measure the iodine level in the blood, and we started also iodine replacement treatment. And now we will manage it also. And really, maybe we will share with you the before and after pictures at the end of 6 months. Without hair transplantation, we are possible to see many baby hairs at the left and right frontal area, and that's really great for us. But still, our biotin level is low, so we need to maybe start intravenous biotin replacement. And today we planned intravenous biotin replacement, then a mesotherapy, and then to continue the whole mesotherapy treatment. And maybe 6 months later we will plan, still if the patient is not satisfied, we will plan a hair transplantation or a stem cell treatment for this woman. We have a question.
ما هي مراحل علاج تساقط الشعر وكم التكلفة في مركزكم؟ رح نجاوب السؤال هذا، رح نسأله كمان بالإنجليزي لحتى اللي ما بيعرفوا عربي يفهموا كمان. What are the stages of hair loss treatment and how much it is in our center? So let's talk first about the stages of hair loss.
Okay, there's a classical international hair loss stages diagram, but I need to see your pictures. So if it is so severe, maybe you should directly go to the hair transplantation. But what I here highlight, even the hair transplantation is the only solution for you. Before the hair transplantation, please make a blood and urine test and see that if you have got any imbalance in your blood, in your urine. By this way, if you make treatment orally and locally, then the hair transplantation results will be more and more stronger. This is the key point that I would like to highlight.
Okay, المراحل لعلاج تساقط الشعر عنا هون انه اول شيء اذا المريض جاي من برا نحن بنستقبل الصور الخاصه بتساقط الشعر عنده وبنقيمها اونلاين قبل ما يجي لعنا. بس اذا هو موجود مثلا بتركيا باسطنبول وحابب يجي لعنا، اول شيء بنعمله هو فول هير تشيك اب. فول هير تشيك اب شو بقلبه؟ بقلبه الاستشاره تبعت الطبيب اللي هي بتفحص الشعر، صحته، شو قد ايه هو عم يتساقط، هل موجود بالعائله تساقط الشعر، الحكايه كامله تبعت المريض بنعرفها وبناخذها، وبعدها بناخذ عينه من الدم لحتى نحللها ونشوف اذا في عنده المريض اي نقص بالفيتامينات المهمه، المعادن، كل شيء بخص الشعر. بناخذ عينه دم، كمان عينه يورين اللي هو البول، وبعد ما نحللها على اساس النتائج نحن بنقرر شو فينا نعمل لهذا المريض. اذا هذا المريض عنده نواقص بهذا الشيء بنغذيها بالحبوب بالمكملات، واذا مثلا ما عنده نقص بنستعمل اللوكال ثيرابي اللي هو العلاج الموضعي. بيكون اوقات في اشياء بخاخات منزليه، ابر منزليه، او بنعمل عنا بالعياده اللي هو الحقن. فنحن مو فورا بنقول المريض بده زراعه شعر، مو فورا بنقول يلا نحقن بلازما، لا، بنمشي على مراحل معينه وبعدها بنقرر شو بيهمه وشو بيفيده هذا المريض. فكتير هذا الشيء مهم، لانه في كتير مراكز بتعمل اشياء مو منيحه، انه مريض عنده تساقط شعر، اوكي يلا نعطيه حقن بلازما. الشيء هذا ما بيصير عنا، وكثير نحن بنهتم بهالمراحل كلها وبنشوف كل مريض حسب هو شو بيفيده وشو لازم نعمل له. اوكي.
Okay. And let me continue to give some more information to you. In medicine, In fact, last 10 to 20 years, even in the United States, there is a new period. The biological normal and the functional normal is totally different. I do really appreciate with the hair transplant patients that you need a functional normal level of vitamin and mineral. What does it mean? Let's say, for example, for vitamin D level, over 30 is normal. Okay, but this is essential for your bones and for your muscles. But if you have a hair loss problem and if your vitamin D level is 30, this is only normal for biological level. Hair is an accessorized, so you need a better level of vitamin D to reach to the hair. And it is same for biotin. We know biotin only for hair, but in fact it's not like that. In our liver, biotin is one of the most important. Vitamin H is the one of the most important vitamin for our liver. If it is at close to the bottom of the biological normal, then this is enough for your liver, but it is not normal for your hair. So for the functional normal, you need biotin at the optimum level. So for iron, for vitamin D level, for magnesium, for iron, I don't want to see the biological normal for my patients. If the patient has got a hair loss problem, I want to see the results of the blood test and the urine for the functional normal, which means that even if for your accessorized hair, you need to have an optimal level of biotin, optimal level of vitamin D, optimal level of iron capacity. So this is important for me. Maybe this is so much technical, but I would like to underline it.
Okay, I'll just translate what you said because it's really important. اللي كانت عم تحكي انه هي نفس الشيء، اهم شيء تشوف التحاليل اللي هي كثير مهمه لتقييم المريض. هلا في سؤال، هل نوعيه الماء المستخدمه في غسيل الراس تسبب تساقط الشعر وجفاف البشره؟ Is the type of water used for hair wash and the skin wash, does it affect hair loss and skin dryness?
Unfortunately, yes. That's why I try to understand if you change the country, the type of the water you use for your hair wash and for your face differs. And when you're born in a country, you are belonging that environment. And when the environment change, in fact, everything is changing, dear Jude. So, for the immigrants, I would like to underline this. At the beginning, the people cannot understand it. But when it takes a little bit longer time, they realize the hair loss. In fact, the hair loss is the last step. Probably you have got many changes in your body. So you should be careful. If your hair loss started, believe in me that not only the water you drink, also the water you wash your hair, you wash your skin, is affecting your body.
اوكي، اللي عم تحكي انه الجينات بتختلف، يعني مثلا نحن اذا انولدنا ببيئه معينه جسمنا والجينات تبعتنا بتكبر وبتنمو وبتتاقلم مع البيئه اللي بتخصنا اللي جاي الجينات منها، فلما بتتغير هي البيئه بيتغير نوع المي المستخدم، طبعا بسبب تساقط الشعر، جفاف للبشره ومشاكل ثانيه. فلهيك خاصه اللي المغتربين اللي بيعيشوا باماكن ثانيه كثير بيأثر عليهم نوعية المي وبيأثر على البشرة والشعر مع بعض. هلا في اجى سؤال، ما سبب عدم زيادة طول الشعر؟ في كثير اسباب لعدم زيادة طول الشعر. لازم اول شيء الفحص، انت امتى بلش عندك عدم زيادة طول الشعر؟ هل مثلا صار في عندك مرضتي، صار في تغيير بالبيئة، صار في عدم تغذية كافية؟ فكتير بيفرق هذا الشيء، فلازم الواحد يحلل ويفحص عن طبيب لحتى يعرف شو السبب الأساسي. أوكي؟ فممكن تكون نقص فيتامينات. أنا ثاني جود، أنا راسي مكان كله عم تصير حبوب شعري كتير طويل يعني هيك جلد شعري بهالسطة really I'm gonna say it in English so everybody understand the question. So in her head there is like pimples around her skull and her hair, yes, like small acne.
Okay.
In her skull and her hair is very long. So
long.
Yes, very long, and she's like having this acne in her scalp. So what could be the reason?
Okay, acne at the scalp is a real problem. So again, I would like to highlight that for the skin or scalp, if you have acne problem, please check your blood test. If you have got any vitamin and mineral deficiency, the acne predisposition is so high. Okay. And later on, if we manage, we have got two ways. In the classical medical way, we directly start an antibiotic treatment for the acne treatment. However, with the functional way, we need to see what is the predisposition for this acne. Probably there is a high level of sebum production. We should manage it. We can manage it with the vitamin and mineral replacement. So we need a double way. That's why I would like to highlight you the vitamin and mineral and all the whole blood test checkup and hormonal imbalance checkup for hair. It is really important. If we see the reason that is inducing your acne production, then we can manage it with the antibiotic treatment. Here the current position is started with a microorganism, so you need to manage it with an antibiotic treatment. But the predisposition factors, if you don't manage it, it will repeat. Mm-hmm. So for the current position, you need an antibiotic treatment, but for the prevention treatment, you need to manage it with other supportive treatments, and you need to see the vitamin and mineral levels and hormonal imbalance.
So للمريضة اللي حكت إنه عم بيطلع حبوب بشعرها براسها، هذا بسبب زيادة إفراز الدهون بمنطقة الفروة الراس. فنحن لازم نعرف شو هذا السبب. هلا كعلاج أولي بنعطي مضاد حيوي لحتى يوقف هاي المشكلة، بس هالمشكلة ممكن تتكرر، فلازم نحن نعرف السبب الرئيسي ونمنعه حتى ما يتكرر مرة ثانية. هذا الشيء كتير مهم، ولازم ضروري الفحص، لأنه أوقات الحبوب على فروة الراس بيكون بسبب عدوى فطرية، فنحن لازم نعرف إذا كانت عدوى فطرية فالمضاد الحيوي ما رح ينفع، لأنه المضاد الحيوي معمول للعدوى البكتيرية مش العدوى الفطرية. هلا بالنسبة للسؤال we have other two questions. Hold on.
Yes, I'm here to answer.
Okay. So what are the oils or hair serums that you advise to strengthen the hair and make it longer?
Okay, this is the really most like question this is the question that I like most.
كتير بنحب هالسؤال هي.
Everybody thinks that with oil you can grow your hair, but no. I'm really so sad about it, but the hair growth, to make it longer and to make it stronger, is something related with your roots. So the oil that you apply to your hair doesn't affect your hair roots. It only affects the quality of your hair. It can make it softer, it can make it easy to brush, but if you want your hair to get longer, or if you want stronger hairs, then you should do something for your hair roots, and it is under 4 milliliter of the scalp. Can you translate?
Of course. اللي عم تقوله انه للاسف في كثير ناس بيفكروا انه الزيوت بتطول الشعر وبتعمله اقوى وهيك. هذا الشيء مش حقيقي، لانه قوة الشعر وتطويل الشعر هي خاصة بالجذور تبعت الشعر، فنحن لما بنحط الزيوت بتكون بس من برا، فهي بتأثر على طبيعة الشعر، نعومته، بس مش أكتر من هيك. فإذا بدكم تقووا الشعر وتزيدوا طول الشعر لازم انتم تغذوا الجذور نفسها. فهاي تغذية الجذور مثلا عنا بالعيادة نحن بنحقن فيتامينات، هي اشياء كتير مهمة لحتى نقوي الشعر من الجذور.
Burada bir şey daha söyle. Can I say something
Sure, of
more
course,
because
of course.
I need your help?
Of course.
Because my poor English is not enough for that. No, believe in me. Şimdi gerçekten hep geliyorlar işte argan yağı, argan oil, is it good? Yes. Or badem yağı, what is it in English?
Almond
oil. These are all good for hair, but it is for hair, not for the root. If something you apply, you want it to be efficient, then you need something in nanoparticular level. Okay, these oils are not in nanoparticular level, so they don't affect the hair roots. They only affect the hair itself. Is it clear?
I don't know. Yes. عم ترجع تعيد على النقطة لأنه كتير مهمة، مثلا مثل زيوت جوز الهند، زيوت الأرغان، زيوت اللوز، هي كلها زيوت كتير مهمة بس للشعر من برا ما بتوصل للجذور لأنها كبيرة بالحجم. فأنتوا لازم تاخدوا اشياء صغيرة بالحجم لحتى توصل للجذور. فالزيوت ما رح تنفع لتطويل وتقوية الشعر بس رح تنفعه من برا. Okay.
And I also use hair oil after the bath to make it easy to brush. But I know that this will make my hair soften. It will not make my hair get stronger or grow up faster. Okay.
So هي عم بتقول انه هي كمان بتستخدم زيوت بعد الحمام لشعرها بس مشان انه يتمشط بطريقه اسهل. فهي بتعرف منيح انه ما رح يساعده بالطول او بالتقويه. Okay.
Ama yine de 3 tane saç yağı söyleyeceksek argan oil, badem yağı ve çam terebentin.
Bir de Hindistan ceviz.
O cilt için.
اوكي. عم تقول بس اذا بدكم تستخدموا زيوت للشعر بتنصح بالارغان وبتنصح باللوز وبتنصح بالبانتين.
Argan oil, badem yağı, çam ağacının çam terebentin yağı damlası. I don't know. We will look and write it.
في شيء ثالث قالته بس ما عم تعرفه بالانجليزي وانا ما عم بعرفه لا بالعربي ولا بالانجليزي.
اكليرز ستوري takip etsinler.
Okay. So keep خليكم عم بتتابعونا مشان
gerçekten kolay değil çünkü her şeyin İngilizcesini bilmek.
Evet. Okay. Zeytesine ولا tuvalet. Okay, I think let's go down. Wait.
There are some questions, I think.
Yes. زيت الصنوبر pine oil. Pine oil.
Thank you very much for your support.
هذا اللي بتنصحه كمان. They said it in both Arabic. They answered it in Arabic and they answered it in English.
That's great. Yeah. Thank you very much.
We have a question here. Do you advise the protein therapy for hair?
Okay, that's my question. I like it very much. For hair growth, hair root support, there are 3 essential products that should be inside all products. One is vitamin, second one is mineral, and the last one is protein. Now, these 3 is essential, but nowadays in Europe, one more step further. Let's go to the 4th step. Near the vitamin, mineral, and protein, let's add growth factors. Because now the science give us this support. Please ask your doctor if the product they use has got more than these 3. Yes, protein is essential. Yes, vitamin is essential. Yes, mineral is essential. But the mesotherapy product that they will apply, does it contain growth factors? really this makes a great change with the mesotherapy success. Can you highlight it with
هلا
their
اللي سأل
languages?
عن علاج البروتين اذا هذا اللي بتقصدوا فيه موجود بالصالونات، بس هي هلا جاوبت سؤال انه بالميزوثيرابي اللي هو الحقن اللي بتستخدم للشعر، فلازم انتم تسالوا اذا موجود فيها عنصر النمو للشعر اللي هو الجروث فاكتور. اذا موجود بهدول بيكون شيء كتير منيح، لانه هن كل الحقن موجود فيها فيتامينات وموجود فيها معادن وموجود فيها بروتين، بس الاهم هو عنصر النمو. فلازم تسالوا الدكتور اللي رح يعمل لكم الحقن اذا موجود عنصر النمو فيه، لانه هو اهم شيء لتغذيه ونمو الشعر.
And here I don't want to make any advertisement, but I would like to highlight what makes my clinic different. So I try to cover it. But look, the tetrapeptide is a protein. The copper peptide is a protein. The hyaluronic acid, it is the one that keeps water close to the hair roots. Or the dexpanthenol, it is one of the most important vitamins that we need for our hair growth. And organic silicium, it is one of the most important mineral for our hair growth. And there are some, but the first two is vascular endothelial growth factor or fibroblast growth factor. Believe in me, only few of the companies, mesotherapy companies, has got growth factors inside the mesotherapy cocktail. So when you come to Istanbul for hair treatment, please ask your doctor, because I'm making many education for the medical clinics, medical doctors. If the product they are using, does it has got hair growth factors inside it? It is really important to make the difference, even in one session or even in 2 sessions. And for our patients, we can apply when they come to Istanbul 1 or 2 mesotherapy sessions. But then we can continue with whole meso products that has got growth factors and peptides, proteins inside it.
Okay. فهي هي نفس الشيء اللي هو اهم شيء المستحضر المستخدم للحقن شو بيكون جواته. هلا هي اللي قلت لكم اياه ما بدها تعمل اعلان للماركه، بس هي عم تقول لكم الشيء اللي بيميز العياده تبعتها وجود البروتينات والفيتامينات والمعادن والعناصر النمو اللازمه موجودين كلها بالمستحضر اللي هي بتستخدمه للحقن. فهذا شيء كتير مهم، لأنه في كتير عيادات تانية بتعمل نفس الشيء ممكن بأسعار أرخص وأسعار إنه الكل بيروح لعندها بس بسبب أسعار رخيصة، بس ما بيكون في بقلب المستحضر شيء بيفيدكم. فهذا الشيء اللي هي كنت عم تقوله وعم تقرأ لكم إياه على العلبة. وبعد الحقن بتعطي للمريض كمان شيء يستعمله بالبيت، يعني يكمل العلاج بالبيت. تمام.
Okay.
What are the most important supplements to take care of the hair health in general?
Okay, thank you very much for this question. Everybody talks about biotin. Everybody talks about the other minerals, iron deficiency. These are great. However, my dear followers and my dear katılımcı participants, if you don't have enough level of vitamin D, none of these oral supplements can work inside your body. So please first measure the vitamin D level. It's a general problem all around the world, because more than 20 years there is a negative promotion that sun is dangerous. Okay, sun is dangerous for skin aging. However, it is essential for our body. If you don't have enough vitamin D level, then the biotin you take doesn't work in your body. The iron for your hair, this is my specialty, so that's why I would like to highlight for it. So, what can I say? Vitamin D is the key of the door. If the door is locked, you take biotin orally, but it doesn't work enough. So open the door first with vitamin D, and then take oral biotin. then take oral zinc, magnesium, and iron. Iron is really so much important. At the bottom level of iron, it is only enough for your red blood cells. They carry oxygen for your body, and it is only enough for that. It is not for your hair. We need better levels. We need functional levels of iron, functional levels of vitamin D and biotin. And what is next? The hormonal imbalance. If you have a problem with your ovaries for the woman, then it doesn't work. So, in generally, we manage the hormonal imbalance of the woman patient, female patient.
أهم شيء أول شيء تفحصوا تعملوا تحليل دم تشوفوا النواقص وعلى أساسه بتاخذوا المكملات اللازمة. بس أهم شيء الكل يكون عنده نسبة فيتامين د كافية. نحن كلنا بنتعرض للشمس بس مش بشكل كافي ومش بشكل مفيد لحتى ناخذ كفايتنا منه. واكثر المشاكل اللي بتصير بجسمنا بمناعتنا بشعرنا بيكون بسبب نقص فيتامين د. فلهيك كثير مهم تشوفوا فيتامين دي. وكمان الشيء الثاني الحديد هو من اكثر الاشياء اللي بتكون ناقصه عند الكل تقريبا. فلهيك لازم تحددوا النقص فيه، واذا انتم على المستوى القليل لازم انتم ترفعوه. ليش؟ لانه المستوى القليل هذا يا دوب بكفي لخلايا جسمكم ولنقل الاكسجين كفايه لباقي جسمكم، فما بكفي انه يوصل للشعر. فلهيك يعني لازم تفحصوا كل شيء. وغير الحديد والفيتامين د في عنا مثلا الزنك، المغنيسيوم، الايود. فهدول الاشياء كثير مهمه، لازم انتم تعملوا تحليل بعدين تحددوا شو ناقصكم. What about salon protein treatments, not the injection?
What does mean salon protein injection?
For the protein bar.
Onlar saç teline iyi gelir. All they are good for brushing the hair. But the hair root is something should be done in the medical clinic by a medical doctor.
Okay. I think she answered in
Bir de
English.
keratin bakımı sevmiyorum.
Okay.
If she is asking for keratin.
Okay. So if you're asking for keratin treatment for moisturizing the hair, she doesn't advise it.
In fact, not moisturizing, only for straightening
the hair.
Okay. In the Arabic culture, unfortunately, they do it a lot, and I have many patients who are really unhappy with that.
Yes. So for the protein treatments in the salon, what they do is actually just take care and moisturize the hair. So you can brush it in an easier way, but it doesn't straighten it. It just like, it works on the outside, not the roots.
And when applied it, they use really heat. And it really damaged the hair.
Okay. So, and when, yes, you said it in English.
But please translate.
Okay. فلما بيستعملوا هذا العلاج بيستخدموا حرارة كتير عالية، فهذا بيدمر الشعر ونوعية الشعر والكيمياء تبعت الشعر. فهذا الشيء كتير بضر الشعر، وبعدين المرضى بيجوا بيعانوا من تساقط الشعر. فهي ما بتنصح فيه. إذا بتنصح بشيء إنه البروتين بس يكون من برا بدون استخدام حرارة، بس يستخدم لترطيب الشعر، إنه يتمشط بطريقة أسهل. فبس يعني علاج ترطيبي، ما بتنصح باستخدام الحرارة ولا الكيراتين اللي بيعمل الشعر ستريت.
كنت بشيء söylemek istiyorum. Is it possible?
Of course.
What is strange in here in my practice, because we are in the middle of the world maybe, the Arabic woman or man want their hair straight. And just the vice versa, if the patient has got straight hair, they want curly. And what we realize in our practice, when you try to do something just opposite to your nature, it damages your body. It damages your heart. That's all.
That's amazing. You're welcome, Sarah. Hocam Türkçe'de bir soru var.
Hocam polikistik over sendromu ile dökülen saçlar düzenli beslenme ve kilo verme ile tekrar çıkar mı? Dear Merve teşekkürler. İzin verirsen bu soruyu da İngilizceye çevirelim. There is a question that is asking for polycystic ovary syndrome, and she says that is it possible with the right feeding and weight loss, is it possible to gain the hairs that will lose due to this polycystic ovary syndrome? It is one of the hardest situation. Türkçe mi cevap vereyim, İngilizce mi? Ben Türkçe cevap vereyim çünkü soru Türkçe, sen İngilizce ya da Arapçaya çevir. Sevgili Merve, gerçekten en zorlandığımız hasta profillerinden bir tanesi. Polikistik over sendromlu kadın hastalar. Eğer genetik olarak ailede saç dökülmesi probleminiz yoksa, sadece polikistik over sendromuna bağlıysa, iyi bir hormon tedavisi, metformin tedavisi, bilmiyorum metformin kullanıyor musun? Glukofaj piyasa ismi. Düzenli beslenme, glutenden serbest bir diyet ve kilo kaybıyla beraber saç destek ürünleriyle size yardımcı olabiliyoruz ama %100 garanti veremiyoruz. Denemek lazım Merveciğim. Do you recommend IGF-1 injection for hair growth? Okay, shall I answer? My best practice for the growth factors is with vascular endothelial growth factor and fibroblast growth factor. Indeed, I do not have enough practice with the insulin growth factor 1. There are some studies that is positive and there are some studies these are negative. So for the moment, the products that I use has got vascular endothelial growth factor VEGF and FGF products inside it.
اوكي.
There's one more Arabic question.
جود طولي مش بيطول، هل هي السبب لأنه شعري كتير طويل؟ لأنه إيش ما آكل بيزيد من شعري وأنا لا طولي بيزيد ولا وزني بيزيد. حبيبتي هذا ما خصه بالشعر، يعني الغذاء هو أشياء جينيا ممكن أنت بالعائلة عندكم الطول مثلا بتأخر، الوزن أنت ما بعرف قد إيه عمرك، كمان في عمر محدد لكل شيء، فيمكن انت لسه صغيره ولسه في عندك وقت لتكبري اكثر وتزيدي بالوزن والطول، فهيك يعني بس بهالجمله انا ما فيني اقول لك شيء مفيد وشيء بيساعدك. Teşekkürler hocam söylüyor Merve.
Ah çok teşekkür ederim. Ben teşekkür ederim Merveciğim. Buradayım, dinliyorum sizi.
عمرك 15 سنة انت لسه صغيرة، بتكبري لسه اكثر، بيزيد وزنك مع الوقت وبيزيد طولك. يعني لسه كتير بكير، فما تفكري انه هو عم بيروح لشعرك بس، بيروح لكل جسمك، بس انت حسب جينيا انتو كيف بالعائلة طبعا شيء بيجي اول، شيء بيجي ثاني، شيء بيجي ثالث، فما تقلقي هذا الشيء ما خصه. Okay, I think that's it.
I think that's good, huh?
Yeah, I think that's good.
Thank you very much for all the participants.
شكرا كثير لكم كلكم على اسئلتكم، وبنشوفكم ان شاء الله بلايف تاني. See you. Thank you.
See you. All the best. Gerçekten çok güzel.